Let's talk about one of the most widely used, deeply studied, and surprisingly practical forms of therapy in modern psychiatry, cognitive behavioral therapy, or CBT. If you've ever been to a therapist, taken a self-help course, or even read up on anxiety or depression, chances are you've heard of CBT. But what exactly is it? How does it work? And what does a CBT session actually look like? In this video, I'll explain CBT from a psychiatrist's perspective, simple, clear, and with real-life examples. You'll learn what CBT is, why it's so effective, who it helps, what happens in a session, and how you can apply some of its principles in your daily life. Let's get into it. What is CBT? Cognitive behavioral therapy, CBT, is a structured, time-limited form of psychotherapy that focuses on how your thoughts, feelings, and behaviors are all connected. At its core, CBT teaches you this. You can't always control what happens to you, but you can learn to change the way you think about it and respond to it. CBT helps people identify and challenge distorted thinking patterns and replace them with more helpful thoughts and actions. It's practical, skills-based, and grounded in science. The CBT triangle. One of the best ways to understand CBT is through the CBT triangle, which shows the connection between thoughts, feelings, behaviors. Let's take an example. You walk into a meeting, everyone's quiet. You think, they're all judging me. You feel anxious, embarrassed. You behave, you avoid eye contact, say nothing, and leave early. But what if you thought, maybe they're just waiting for it to start, it's not about me? You'd feel calmer and probably stay and engage. CBT teaches you to catch the thought, question it, and choose a better response. Who is CBT for? CBT has been proven effective for depression, anxiety disorders, social anxiety, phobias, panic disorder, PTSD, OCD, eating disorders, insomnia, chronic pain, substance use, bipolar disorder as an adjunct, and it's useful across all ages, from children to seniors. CBT is also effective in group settings, online platforms, and self-guided formats. What CBT is not, let's clear up some misconceptions. CBT is not just positive thinking, repressing your emotions, pretending everything is fine, a one-size-fits-all solution, a quick fix for complex trauma, though it can help alongside other therapies. CBT is about understanding how your mind works and learning skills to manage it better. What happens in a CBT session? Let's walk through a typical CBT session. 1. Check-in. The therapist might ask, how have you been feeling this week? Any situations that triggered strong thoughts or emotions? Any goals from last session to follow up on? 2. Agenda setting. CBT is collaborative. You and your therapist set a plan together. Example, today, let's focus on the panic you felt in the grocery store. 3. Identifying thoughts. You talk through the situation and your automatic thoughts. Example, situation, I had a panic attack in the store. Thought, I'm going to die. Everyone is staring at me. Feeling, fear, shame, behavior. You left your cart and rushed out. 4. Cognitive restructuring. This is the heart of CBT, challenging unhelpful thoughts and replacing them with more balanced ones. Your therapist might ask, what's the evidence for and against that thought? What would you say to a friend who thought that? Is there another way to see the situation? You might come up with a more helpful thought. I felt panic, but it passed. People may have noticed, but most were focused on themselves. 5. Behavioral experiments or homework. CBT is action-oriented. You might be asked to keep a thought log, practice breathing exercises, try exposure to feared situations, track mood and triggers, challenge a belief through real-life testing. Between sessions, you practice. That's where change really happens. CBT in action. 3. Examples. Let's look at some real-world applications. Example 1. Depression clients thought, I'm a failure. Nothing I do matters. CBT tools. Identify the core belief. Examine the evidence. Introduce a thought challenge. What small success did you have this week? Behavioral activation. Schedule one enjoyable activity. Reframed thought. I've been struggling, but I've also been showing up. That counts. Example 2. Social anxiety clients thought, I'll say something stupid and everyone will laugh. CBT tools. Predict and test the belief. Go to a small event, speak once, reflect on outcome. No one laughed, some even nodded. Rate anxiety before and after reframe thought. I get nervous, but I can handle social settings better than I thought. Example 3, OCD clients thought, if I don't check the lock 5 times, something bad will happen. CBT tools, exposure and response prevention, ERP. Leave the house after checking once, sit with discomfort. Track anxiety, it peaks and then falls. New learning, nothing bad happened, the anxiety faded without the compulsion. CBT techniques you can try at home. Even if you're not in therapy, you can try some CBT principles yourself. Thought record. Write down the situation, your automatic thought, your emotion, 0, 100%. A more helpful thought, the new emotion. It's like journaling, but with structure and insight. Cognitive distortion. Check, learn to spot thinking traps like all or nothing thinking. If I fail once, I'm a total failure. Catastrophizing, if I mess this up, I'll lose everything. Mind reading, they think I'm boring. Fortune telling, I just know this will go badly. Catch the distortion, challenge it, and reframe. Behavioral activation, feeling down, schedule one small, rewarding or meaningful activity a day. Take a walk, call a friend, cook something, clean a drawer, write for 10 minutes. Mood often follows action. How CBT fits into psychiatry. As a psychiatrist, I often recommend CBT alongside medications, refer patients to CBT-trained therapists, reinforce CBT principles during medication. Follow-ups use CBT-informed strategies myself, especially for anxiety and depression CBT. And medications can be complementary, not competing. CBT teaches skills, meds stabilize symptoms. Together, they give people more tools to live better lives. Does CBT work? Short answer, yes, and the research backs it up. CBT has one of the strongest evidence bases in mental health. It's been shown to reduce relapse in depression, outperform medication in mild-moderate anxiety, be as effective as SSRIs in panic disorder, improve functioning in PTSD, OCD, and eating disorders, help even in chronic conditions. It's not magic, but it's science, and it works best when practiced regularly. Final thoughts. CBT isn't about denying your feelings. It's about understanding how your thoughts shape your experience and learning how to shift them. It's about turning "I can't handle this" into "this is hard, but I have tools. I've handled things before." And over time, those tools become habits, and those habits change lives. So whether you're working with a therapist, reading a workbook, or just getting started, CBT is a powerful place to begin. If this video helped you understand CBT better, give it a like, subscribe, and share it with someone who might benefit. Drop a comment. Have you tried CBT? What techniques helped you most? Until next time, take care of your mind. And remember, thoughts are not facts. They're starting points, and you can learn to change them.